go in for your annual exam to get screened for breast cancer. We're actually joined here by Dr. Katie Brite. Thank you so much for being here this morning.
Thank you for having me.
Yeah, so how important is it to go in for your annual exam for this?
It is so important, and I'm excited to have the opportunity to talk about it. You know, I don't know if everybody knows this or not, but breast cancer is the most prevalent type of cancer for women in the U.S. So about 1 in 8 of us are in our lifetime going to have to deal with breast cancer. So the screening is huge. And as a primary care doctor, family physician, for me, breast cancer awareness is every day all year. But I'm so excited when October rolls around and we get to have this opportunity to educate our society about the importance of breast cancer screening.
Most definitely. And what are some of the signs that people or women should look out for?
So a lot of times breast cancer is completely asymptomatic, so no symptoms at all. And that's why we talk a lot about breast cancer screening. And getting that mammogram, whether you have symptoms or not, is really important. Sometimes, so you talked about don't be a chump, look for a lump. So just knowing your breast tissue. A lot of us have lumpy, bumpy breasts. That's normal, but knowing what's normal for you. So if you do see something or feel something abnormal, sometimes it's a painless lump. Come on in and get that. Let's talk about it. Nipple discharge. You might have an itchy sensation, a rash, a lump in your armpit. All of those things are important things to notice, and come in and see your doctor so we can discuss it and decide what's best for diagnosis and working that up.
A lot of times I know that tumors can actually be found really not through mammograms, through actually just noticing a lump.
Right, but unfortunately that's not usually the case. What's more common, and why we recommend screening for every woman, is that we find it early before it's even been detected by the woman. So better even than my clinical breast exam or what you can do by yourself is that mammogram. And so we start breast cancer screening depending on it's a case-by-case basis. So for everybody, regardless of risk factors, by 45 to 50, and have that discussion with your primary care physician, with your doctor, and then it's at least every other year, because most often we're going to detect it through the mammogram.
And it's also very important to make sure you go to a doctor to get your information. Don't just Google it.
Absolutely.
And take information from you.
The Google search can be super scary, and it's also case by case. So my patients ask me about risk factors, and everybody's different. So we do want to know things like family history of breast cancer is really important, particularly those first-degree relatives. Meaning a sister, a mom, a daughter. That helps us understand when you need to start screening. And usually it's going to be, like we talked about, 45 to 50 or 10 years before that first-degree relative. So if your mom had breast cancer at 47, we're going to start screening you at 37. And so it's really important to have that discussion with your primary care provider, your OBGYN.
Great. Thank you so much, Dr. Brite. We really, really appreciate all of this information.